Now, the Eastern Cape Health MEC has officially launched a landmark in-vitro fertilization clinic at Nelson Mandela Academic Hospital in Mthatha. The facility, developed over 10 years at a cost of 18 million rands, becomes one of the only 5 public hospitals in South Africa to offer IVF services. The clinic is already operational with more than 10 patients undergoing treatment, signaling a major breakthrough in access to specialized fertility care for women and couples in underserved communities. Newzroom Afrika's Liyema Vumisa reports.
The IVF clinic at Nelson Mandela Academic Hospital in Mthatha is being hailed as a huge milestone as it grants access to specialized fertility care for rural women and couples in the Eastern Cape. The state-of-the-art facility, one of only a handful in the Western Cape, Gauteng and the Free State, boasts advanced equipment and specialist care.
It's been a very long journey, and for instance, it started with training of the specialists which are in the unit, and currently we are very grateful we have 2 specialists.
The Eastern Cape's Deputy Director General for Clinical Services has described the unit as a historic development, saying it will significantly benefit residents, particularly those in rural areas.
It's a milestone. More than a milestone, it's history. History for the people of South Africa and history for the people of Eastern Cape. In many respects, the fact that it's a new service in the Eastern Cape, in a public health facility, and also is located in the deep rural setup, as you are aware.
At the official opening, Health MEC Ntandokazi Kapa assured patients that IVF services would be accessible to all who need them, regardless of their financial circumstances.
Yes, they are going to pay for it, but it's going to be a co-payment system. Remember, there are those who've got medical aid, but they would want to access this service. So they will have to come, we will give them an opportunity, but they will pay lesser than they will pay in the private sector. At the private sector, we'll be sitting at about 100,000, but with us, we are thinking that at least we'll pay about 35,000. Those who can have funds, or those who are covered with medical aid. But we also said this is a public institution. There will be exceptional cases for people in the rural areas. We'll bring them to our facility and see how then do we assist them as a department.
She adds that of more than 300 patients who met the required criteria, 14 are already undergoing treatment. For years, only about 1 in 10 South Africans who needed IVF could access it, leaving countless couples in rural and low-income areas with no hope. Now, with the opening of Mthatha's state-of-the-art clinic, that hope becomes real, bringing expert care, cutting-edge technology, and the chance at parenthood to families who once had none. For Newzroom Afrika on Channel 405, I am Liyema Vumisa in Mthatha, Eastern Cape.